Yep, I can
Hi.
hear you. Can you hear me, Lise?
Yes, we can.
Okie dokie. Hello, everybody.
Hello.
Welcome to Teams. And just know that we are recording and transcribing. So keep that in mind, please. Happy belated birthday, Dr. Pam.
Thank you, Lisa.
Another year younger.
I know. I start going backwards now.
Yes, I think that's the way it should work.
Yes.
It's been a long time since we've done one of these meetings.
I know. When was the last one?
A long time ago. I couldn't even tell you.
Well, I'm glad we're doing it today.
Yep. It's just the Teams platform is a little iffy, but that's all good. Gina got us set up before. How you doing, Sarah?
I'm doing all right. How about yourself?
Yeah. It's Tuesday and it feels like Friday.
I mean, there's been a lot going on this week. It sure feels like the whole week has passed and not just a day and a half.
Yes. Just give us a few minutes and then we will start up. I know we have a few more people joining us today as well. We have all of our team members on, which is great. We already had a dry run through of this presentation this morning, so with another company, so it was perfect. Welcome, everyone. Just give us a few minutes and we will get started. Oh, I should have said and share your organization. That's what I meant to say. We're going to hang out for a few more minutes. Thank you for joining us today. Hi, Kristen. Hi, Ernie.
Hello.
There are some people on this call that I haven't seen in a long time. Hi, Renee.
Hello.
Long time no see.
It has. I thought I would hop on here today and just kind of get reacquainted and see what's happening in your world.
Oh, this is a great time. So just keep in mind too, when we get going, always feel free. If you have comments or questions as we're going along, we welcome that. Would love to have more, just engage dialogue too along the way. There is going to be a lot of information that we're sharing today, and we are fortunate that we have a number of our team members that are going to be sharing more details about specific services as well. We'll wait about one more minute and then we will get started. Again, I'm sitting here in my like winter jacket because for whatever reason, I'm having a hard time adjusting to fall. Children are making fun of me already. So we will go ahead and get started. Again, I am Lisa Cruz. I serve as the Executive Director of the Multicultural Coalition. It has been a long time since we have had an online meeting. So thank you to everyone for being here, being a part of this. And again, if you haven't had a chance, go ahead and introduce yourself online in the chat. I'm going to say right now, forgive me for my clumsiness with Teams. Hopefully it's gotten a little bit better, but I ask for your grace. And with that, we are going to go ahead and get started. I think for the most part, just kind of looking at who's joining us today, I know that there are some longtime friends, handful of new people that maybe this is the first time. We are the Multicultural Coalition, and we started up in during the pandemic, community organizing. Many of the people you see listed in here who we started organizing with are our board members today. So thank you to our board members for being here with us today as well. And always want to start with gratitude to those in the community who have been supporting us from our inception. Again, we started organizing in 2020, became a 501c3 in 22, moved into our current location a couple of years ago. There are 5 staff members, so you will see them listed as well. So just want to be very thankful in everybody's support in helping us get to where we are today, because it truly, we need the community support more than ever. And we're going to get into a little bit more of those details as we go along as well. So thank you again. So just to go over our mission and vision, if you're not familiar with this, we adjusted this about a couple of years ago. So it's about focusing and elevating all communities through responsive and innovative actions to create and build a movement of positive and sustainable change together. I just told this story again this morning to another company that was visiting us. Is in the words of a great leader, Dr. Pam, I remember early on in our organizing, you said, we are so tired of talking, we want action. And action has really driven us forward in our body of work today, and is very, very critical to what we can accomplish. And then what does that vision look like? You know, so looking at us as a community that can prosper together, getting rid of barriers, and centering humanitarianism, which it seems very simple, but can be complex. And we've been very intentional about building an organization with the elimination of barriers, and really how can we connect as human to human. This has really been central to our work, working on trust building, relationship building, and connecting as humans. And you're going to hear more examples of that this morning as well. If you want to look at some of the values we subscribe to, we made one word up. It was InnoAction, meaning innovative action. How can we be innovative in our approach and take action in a sustainable way? We are community oriented, seeking connections, interconnections that speak to the heart and depth of the human experience. And how can we advocate? I would bet that every minute of every day we are advocating in some small, big way together and individually. And then how can we uplift one another with joy? So again, you will see and hear some examples of all these areas, all of our values. We strive to live them out in the work we do. And it really is the process with which we look through when we evaluate something. Are we living up to these values? So just wanted to touch upon a little bit of the current climate because I think all of us get this question all the time, like, what does the current climate look like? And the struggle is real and it's more complex than ever. I've heard some of the community say that this is what's going on is actually worse than the pandemic. So I outlined just a few things here. You have the individual in the middle and what's happening. So I'll give you an example of a month and a half ago, we were hearing about a number of employers letting employees go because uncertain of work status, work programs. And so employers were letting go employees, which meant that there was a ripple effect from loss of job, employment, to then maybe can't make rent, don't have access to basic needs. So it was just this complexity going on in a number of communities we serve. And then that social connectedness, you're really going to hear me hit upon that. All of us here today hit upon that hard. That social connectedness is huge. And we will share one of our example of what's going on in our space in particular, but how do we create that safe space of belonging? And how do we connect the dots? When you look at the continuum of mental health, and social connectedness is certainly a high priority on that continuum. And then looking at overall the fear that's taking place, we often get messages saying, hey, I saw this, I heard this. So in particular, with ICE being in the area, the team knows that we are not going to fan the flames of misinformation, but we need to verify. So we want to make sure that we're not scaring people unnecessarily. So if we do get wind of something like that, we always try to vet that. In addition to that, we have also gone out and met with every in our 3-county region. And if we missed one, I'm hoping we didn't, with every police department, every sheriff department. And it's really important that we have relationships in place. If things happen, that we are able to connect and communicate as needed. And that has been really helpful for us to hear what exactly is going on in the communities from the law enforcement perspective, and for us to share with them what's going on for our community members as well. So I talked a little bit about our humanitarian approach, and if you hear me speak about this, I'm always like, oh my gosh, I can't even believe I have to say this, but this human to human connection now more than ever is critical, and really to what we're trying to do, not just at our space or our building, but in our outreach efforts as well. Just making sure that every person is being met where they are physically, mentally, in a dignified, compassionate manner. And how can we co-create a safe space? And from my perspective, community organizing for the past 5 years, it's really taken that long to get to that place of trust with a lot of community members we serve. And that is totally fair. So I also included a quote on the bottom of this slide, just because there's a woman who comes in frequently to our space, and she just looked at me and she said, thank you for always making me feel welcome. And that's when we know we're making an impact. Any person that walks through our door, you're going to feel that experience. And really centering everything on the belonging aspect. So we talked a little bit about the social connectedness, that intersection of backgrounds, being able to be vulnerable in this space that we're co-creating with our community members. And just one thing I found, and there was more to share, but I only had so much room, was just taking a look at the snapshot of how people are feeling. And back in 2022, 31% just in Outagamie County were reporting feeling lonely. And I have no doubt that the reports coming out in the future will demonstrate probably a little bit more growth. And I know when we did our belonging surveys back in 22, it was at least, I think it was like 21, 22% of people feeling lonely. So if you look it up, you can find all these growing stats about that sense of isolation and loneliness. You couple that with fear, loss of job, and you can understand the complexity of what we are working in today. So when we talk about the isolation and the fear and all the complexity, I wanted to share this photo with you and also these words with you. Is we are getting to that place of belonging. So you can see right here, many of you have heard us talk about Walk-In Wednesday, and I'll talk a little bit more about it, but this is literally what's happening on a Wednesday in 2 hours when we serve more than 50 households. And we are literally, I like to say, cranking. I don't know if that's a common term, but we are hustling. But if you walked into this space on a Wednesday, you will see this intersection of humanity taking place where we might have a refugee from the Congo, a grandma talking to a Latina woman about their grandchildren in 2 different languages and sharing. You will have children with different backgrounds playing together. A woman feels comfortable enough breastfeeding her baby out in the front conference room. So it's this beautiful co-creation of safe space. And again, I know that this is a physical building, but everywhere we go in our outreach efforts, this is what we're trying to create and working with with the trusted relationships. So I just wanted to try to paint that picture a little bit. Anyone on this call is always welcome to join us on a Wednesday. It can be overwhelming, but it's also like I was sharing this morning that every Walk-In Wednesday that we have, there's always a moment. It's like 5-second moment where I just feel like I could just start crying. And the reason is it's just so overwhelming to see this taking place in the midst of all the chaos around us. So it's extremely centering and you feel that experience. This goes through just some of the programming and then we'll start to break this down a little bit. We have our outreach program. We have the Walk-In Wednesdays, the Calumet County Outreach, the inclusion in the outdoors, everything, again, centered on belonging. How can we create a different experience for each person we meet, we encounter, we connect with? And then how do we eliminate those barriers along the way? That is constant. How are we embracing culture? How are we listening? How are we taking action? So these just give you kind of, if you could take these 2 diagrams, I think, and lay them over one another for really powerful, centered in belonging. So this describes a little bit of our community care model. If you're not familiar with community health workers, that is a certification. There are a few entities where people can become certified, many for the work they've already been doing in our community for years. So this means like peer-to-peer support in health and well-being. So we have 4 team members who are community health workers. 1 just enrolled in the apprenticeship program as well. We have ongoing training taking place that we participate in, especially in that aspect of legal support. We offer our community members monthly consultations with an attorney. to help with citizenship or whatever they need. Then we have the ongoing trusted referral partnerships. I think many of you know, and Trish is going to join us in a few minutes regarding Partnership Community Health Center. We are conducting ongoing home visits. That is all the time. And I don't like to say this because we need to also protect our community or our community health workers, our team members space as well. But like those home visits are extensive and don't necessarily happen between 9 to 5. Then we have our rural outreach. A lot of that takes place in Calumet County. Obviously, we're supporting in basic needs. And of course, that basic needs is where you connect. We often have our car stuffed with diapers and personal hygiene items, or maybe beans and rice. But it's that connection, and then you figure out from there what else is needed. And then certainly navigation and advocacy, which team members will talk more about today. Any questions or comments as we're moving through this so far? I just wanted to address then again, just to give you the scope of growth in the past 18 months. Like when we started, I'm gonna pick on Walk-In Wednesday a little bit. I know many of you have heard us say like we had 50 families and now we're up to about 550 families. So that keeps growing off the charts. What we are finding is everybody asks like, well, how do people find out about you? It is word of mouth. It's those who have been visiting us, tell others. And then also we're finding that a number of more institutional type referrals are taking place as well, which we welcome. We already talked a little bit about the complexity of needs. It's not just one thing, it's multiple layered needs. We are seeing a lot in that space of that social connectedness again, as I shared a little bit, and the mental health suffering, which is like, it's just a ripple effect again. If one thing leads to the next. And then we also have cultural barriers as well into the more mental health typical provider model as well. And that's why that peer support is so important. So that just kind of gives you an idea of growth. And I'm going to go back to one of the programs we talked a little bit about, Walk-In Wednesdays. Just want to point out here, we also have on-site resources with us. And what does that mean? Well, that means like, for example, Feeding America is often here and they can talk about food programs, eligibility, etc. We have Bertha 5 here, for example, as well. Jenny is here with us on site week after week. The families know who she is. So what we're doing is doing on-site referrals right there and then. And that has really been beneficial as well. A lot of times we will have BMO on site with us addressing credit issues or banking issues, really focused on that education. So the on-site referrals with us has been really, really beneficial too. So to make sure like we're all there, again, addressing whatever we can or making appointments or also sending referrals out. Partnership is also on site with us. This last Wednesday, we had blood pressure checks, which was really well received. Again, we have hosted about 31 Walk-In Wednesdays this year due to human resources, financial resources. Right now, we're always flexing and changing. We are doing Walk-In Wednesday every other Wednesday and still keeping that 2-hour period. This just kind of gives you the number of individuals based on the number of households we're supporting. And then when I talked about on-site trusted referrals, just like in the last, I think 6 to 8 months, we've made 170 referrals to those partners. So again, just making sure that we're wrapping our community members in love and care as much as possible to make sure that they get what they need. So with that, I'm going to turn it over to Dora Fabian.
Hi, hola. Um, Thank you, Lisa. I want to share with you guys a little bit about my program. I'm the community outreach director, and part of my program is when we have our friends come for the bodega on Wednesdays, and they start to share all the worries that they have. So the most important is this one is when I recently start with this program, and we have this family who came to me, I think last May, and that was the mom who is worried about her son. She can find the son for 4 days, and he went to a 3 house away from his house, and he never back. So they recently came from Mexico, so they don't know where to go or what or who can help. They knock on doors, but they don't have the answer. So they come to me, and we start to see, okay, what's going on and who we have to contact. So we contact the authorities. I contact Lisa, and I say, Lisa, I need your help. This is totally new to me. And this organization start to do everything. Call the medias, call the detectives. We're working with everybody. Unfortunately, we found the body 10 days after, and but we work with the parents very close. We do the best we can, and the family was happy with us, and they say like they really appreciate because all the support they have was wonderful. Dad wants to find something to believe that his son is dead because he wasn't able to see the body. And the detective was very nice, and it's something I always say because that was very, very nice for her. The detective found some bracelet for Diego in Diego's hands. So they're very careful. The forensics took out and they put it away and they give it to the dad, and that is when he know his son was gone. So this is one of the why it's so important when we have the families here. They know who we are, and they know that we are going to do the best to help them. In this case, or in many other cases, we working with some people with cancer. Right now, we have 3 clients with cancer, and we try to bring one of the families from Mexico to take care of her. We have another family with diabetes, and so we have many situations. But the thing is, the people trust us, and they trust this organization, and we are trying to do our best. You want to change? This is another one. We have the mom who is coming every Wednesday to get him food, and she was talking about they don't have a place to live. So I say, okay, so if you coming for food, where do you cook? And she's like, well, right now we are hiding in a basement in an empty house. And I say, you don't mind to take me there? So she took me to the house, and this is the basement. The kids sleep right there, and they put like a blanket. They get it from St. Vincent de Paul, and they sleep in the floor. They don't have a bathroom, no water, no electricity. The kids are very sad. They really want to have a house. And so what I did is working with the mom and try to find a place. And many organizations, we don't do we didn't pay the hotels. So I went to shelters, and they fall. They, they have the waiting list. We stay in one shelter, and we stay there for many hours until they say, okay, after 8 hours, they say, okay, we have a small room that they can stay. So they finally they let the family stay in the shelter, so they don't have to go back to the basement, because the kids is like something refusing, and it's like, my God, they broke my heart. I want to take the family to my house and I can, but um, we found the shelter. So this is why we're working together with organizations. I not call, I go there and I see how they can help me. If they cannot able to help, we are looking for another organization, and we stay there and we knock doors, but we work together with our friends because they need us and they don't know what to do. And this is why sometimes people ended in the street, because for some organizations, it's so easy to say, oh, we have a waiting list. I'm sorry. But what were you going to do? In this case, what do I going to do with this family? So I have to do something. My heart is with them. So thanks God, we found the solution, and I don't know how they're doing now, but I hope they're doing well, and my heart is with them. And this is the good news. We're working with people in the applications to try to get the status in the country, because, for so many things that happen right now. Thanks God, we make 8 citizen applications this year. We had 6 resident applications. We had 6 new citizens. So that is very nice, because they now, like, they can travel anytime. They don't have to worry, and it's amazing, because they not spend all the money that the lawyer's asking. We have a lawyer who is helping us once a month. He do a free consultation, 45 minutes, and he told us the steps that we have to do, so they don't have to spend money for something like citizenship or for resident application. He says something that they can do it by themselves. So he teach us how to do it, and I support them. Plus, I doing the DOG accreditation representative for immigration program. So my class is going to start next month. and well, practically this is what I say. I want to say. Is any of you have a questions? If not, we can go to the next.
Thank you,
Hello.
Dora. Go ahead.
Hello, everybody. So, my name is Maria Mason. I'm going to be sharing with you a little bit today about some of the outreach that we're doing in Calumet County. So we just completed a summer series out in Brothertown. This series it's the second summer that we've been out in this area, and there is a mobile park that we have been serving, and where we meet, I just kind of have to laugh about this. Giving my teammates the address to this location is like literally just the corner. It's like a vacant lot on a 2-street corner. So the pictures here, you're seeing us out in that space. And so this year we had 6 events that we held on site here in collaboration with the Chilton Public Library. And so this has been an exceptional collaboration. The Chilton Public Library comes out with a team, and they offer a bilingual story time. And then there's usually like an activity or something for the kids that correlates with the story that's being shared. And then MCI is out in the lot with like our mobile bodega. So we are bringing diapers, hygiene products, clothes, usually something specifically for the kids, and even the fresh produce from our New Hmong elders has made its way out to this Brothertown lot. So it was wildly successful for year two. And last year, we went and we invited people to come. This year, we had folks that were waiting to join us and get walked over to the lot. So it was very lovely to meet with these groups of families again and meet some new families that have entered that area as well. And we really have had, I want to just speak a little bit to the collaboration with the Chilton Public Library. We have had such an excellent partnership with the library. From the inception of MCI and the Chilton Library coming together, it really has just been lightning in a bottle, where the library is really focused on building out their bilingual programming, and they appreciate the model that MCI brings to the table of building trust with our community members. And so I think this is just a really great example. This event is a really great example of the importance of that trust building. The events themselves, you can see that people are starting to recognize us and they trust us and they're happy to see us. So that's always good to see. Just some kind of like really high level highlights that have come through our office. This year, we have welcomed 75 pallets of diapers into our bodega program. And some of those diapers, I believe, have probably come across into your organizations as well. So I think we've touched over 20 organizations that we have shared diapers with. And of course, Kimberly Clark, our Fox Communities Credit Union, and Bolt for coming through in that very large shipment of diapers that we had. And just to kind of roll quickly through the bodega program itself. So Lisa had touched on some of the growth that we've seen as an organization, but this is like my favorite statistic that I've ever even been able to share is that from the inception of the bodega to now, we have seen a 1,150% increase in participation in this program. So this program has gone from just like a really nice way to, accommodate a few of our families to it has become its own entity. So very cool. And the number of families that we're touching in that 2-hour time frame, we're serving about 300 individuals per week in that program. So it really is impressive. And thank you to all of the resources and folks that support that program. Our third annual back to school drive we had this year, we were able to fill and support 150 backpacks and students, which is always fantastic. And just a shameless plug that to the end of this week, we are still running our winter gear drive. So you are still able to coordinate with me to drop off donations at our office, whether it be in-kind donations or monetary donations to that drive. And we will deploy those items next week, Wednesday, when we host our walk-in hours. But also just know that throughout the winter months, we will continue to see families that will need those supports. So you are welcome to continue to donate those items. So I wanted to take a little bit of a pause here, and I wanted to bring my counterpart Myra into this conversation. So I did touch a little bit on our collaboration with the Chilton Public Library, but we have offered an additional educational opportunity. So Myra, would you be able to speak to that?
Yes, thank you, Maria. Good afternoon. Buenas tardes, everyone. My name is Myra. I am the newbie in this office. I started it unofficially probably like a year ago, part-time, and a couple months ago, I became full-time here with MCI. The partnership that Maria was talking about with um, the Chilton Public Library, we started it to doing some educational resources, or the families in Chilton were asking for information about, how to do accounts. My kids are not going to school. Um, what community resources are out there. So Maria and I decided to put this together. And I started it with educational programming, which was this month about financial aid, how to choose a college, the barriers, scholarships, and all that out. The next one, it's going to be about the power of attorney. And the power of attorney will be like a second plan or plan B, how to help families in case of deportation, detention, or anything. Given it that way. What the families going to do, where the families are going, where the kids are going to go, who the houses, because we had many people who has come through us that we have been able to help um, get the stuff out of the apartment because they have been detained and they don't have anyone over here. I was responsible for selling someone's car, getting to the apartment, clean the apartments out, and things like that. That it should be put up, we feel like, as a plan B to help families out in case of need. We also were doing a financial, like how to open accounts and I'm working with FISC, again, in partnership with FISC or one of the banks, to see if we can set that up in the oncoming months, how to have a savings account, the banking system. We don't trust banks in many of our communities. And finally, at the end, we're going to do the community resource, and we're going to bring some of the main community resources that are needed out into Chilton for them to be able to have shots, be able to do the clinics, the dental assistants, things like that. So that is kind of like what we're working with the partnerships of. I guess I'm going right into the inclusion in the outdoor program. Like I said, the mission, this program started it probably, I believe, in 24, around September of 24, and it was a grant through the Community Foundation and Lake Michigan. And the vision or the mission, the mission of the statement of the program itself is to make outdoor spaces and activities more welcoming, inclusive, and accessible for members of historically marginalized group through our research, advocacy, and programming. And our vision is so all can enjoy outdoor spaces and activities from barriers. We're finding out that many of us, as families, we go to work, come home, go to work, come home, and we don't know exactly what's right outside in our backyards. So these are some examples. We have done this year 6 outdoor experience. They've come to the new zoo. We have done the Bubbles Natural Preserve with high school in Little Chute. We did Cave of the Mountains, and that was with families from here, from our building. So there were a bus going from here to the Cave of the Mountains. We also did one to Door County. In the winter, we had a chance last year through our U.S. Venture, to attend the Packer Stadium Winter Games. Families were insanely happy about that. And we are doing the first community garden project in partnership for the next phase. And that's Maria and I were also working through that. So we also, through this program, we'll be able to distribute 6 bikes that they were donated through US Venture, brand new bikes, to families in need. So we had some, the picture that you see there are two, they are from Haiti and they were in need of cars or transportation, how to get to work. So they have bikes. We also gave a client from People of Progression. We're trying to give it to families that they're actually in need, not just someone who needs a bike, but someone that needs us for transportation. And again, we partnership with multiple organizations, as you can see in the page that I'm working with, most recently with the First Nation group. I'm trying to get some of our First Nation members to attend some of our events. So that is for me. Thank you very much for listening.
Good afternoon, everyone. I'm Trish Sarvella from Partnership Community Health Center, and just looking at all of the people who are on the call, it is great to have so much support for this work. I can't help but be inspired when I listen to the stories that the MCI team is sharing, and to think that this is something that really bubbled up from the depths of the pandemic to now an organization that's responding directly to community need. And needs are continually changing. And one of the things that we know is our partnership with MCI as partnership is that we really need to make sure that we remain relevant to what community members and patients and others really are identifying as their key drivers of things that they need for their health. So as we've been a partner here, it has been truly an embedded work. You've heard the partnership has been on site doing blood pressure, and Myra mentions that how can we get out into Calumet County to address the dental needs or the behavioral health needs, the physical health needs. And this isn't an add water and mix approach. This is really something that, as we take very seriously, being a trusted community partner to be part of all of this. And when you go to the next slide and we think about what the impact is of where we've come as an organization partnership in order to meet our mission could not happen without the relationship that we have deep at the grassroots community level in terms of engaging the most vulnerable members of our community and finding ways to engage them barrier-free, speak their language, bring healthcare to them through trusted partners. When I think Maria talking about the library and the work there, making that linkage between literacy, health literacy, making the connection to the banking, bringing all of the people together so we're really collectively addressing how to become a healthy community. It's not just getting your insulin. It's not just enrolling into health insurance. It's bringing this whole sense of belonging together. We were at an event in the basement of the Menasha Library once in the mid-pandemic, and I remember asking a gentleman there, so, what brought you here? And he pulled out his phone and he said, well, you invited me. And I said, we invited you. And he says, yeah, I'm a member at Partnership. And we had texted out all of our patients in multiple languages, letting them know that there was vaccine access there. And when someone can say that not only did they feel like they were invited, but they were a member of something, creating that sense of belonging is so much more powerful than anything we can do individually and bringing the community together. And as Lisa and I were talking about this report back, we really wanted to share what this partnership has really meant, that as we are out in the community, as MCI is really touching people, whether it's in Brothertown or at the libraries or doing work deep in the Latino community, we're able to then provide people with wraparound health care. So I look at our patient profile from 2024, and we had 1,600 plus new primary care patients. Now, this isn't for dental or behavioral health. This was just people coming in for the first time accessing care here. And when you look at the range of their languages, where they've come from, who they are, the average age, this is a direct result of the engagement that MCI does in the community to connect people up, not only to the fact that we can help them with health insurance coverage, but we can make sure that they're engaged in healthcare. And when you're engaged in healthcare, what happens? You take care of issues. You're able to address what might be worrying you. Your child might be more academically successful. You might be back to work because we've helped you with a healthcare issue. And when I look at these 1,600 people whose lives have changed, I look back to MCI and the work that's being done at the grassroots. And not only do we say thank you, but we say this is a partnership of the sense of connection and belonging that bring in a trusted way people who need the care the most and keep them connected. It's not a one and done approach. It's really how do we engage? How do we keep our community healthy so we can all move forward together?
Thank you, Trish. Thank you, team members. So, of course, I have the one slide in here, what's next? So we keep putting one foot in front of the other. But I want to highlight, well, these 4 things are going to be our areas of focus, but also want to make sure that we are taking care of our team members, our caregivers. So that's really an area of focus for us as a team, because going to the orange block on this page, we have to make sure that we're sustainable as well. So how do we build sustainability in our people, in our programs, in our organization, all the way around? So everything we look at, okay, we have this program, but how do we build it and make sure it's sustainable? That is going to be incredibly important to us. And then, as I mentioned, another area of focus based on where we're at in today's world, how do we make sure that we're supporting one another in that continuum of mental health? If it's peer-to-peer support, if it's a more traditional provider, if it's a community health worker, what does that look like? And make sure that we're really connecting culturally in the best interest of those we serve. And then also bringing back our well-being surveys. So it's been a few years since we've done that. So we look forward to taking the pulse of the community as well and making sure that we're listening to what our community members are sharing with us. So with that, I think we can move it over to questions, comments, anything anyone wants to share with us as well. And don't be shy.
Lisa, I would love to share just a success story that we've had with one of your members with MCI.
Please go ahead, Kyle. If you don't know Kyle, Kyle is another partner that I don't even remember how and when this came to be, but Kyle and his team keep showing up as well.
Yes, it's really been wonderful partnering with MCI. The impact that you guys are having is tremendous. We love being part of the Walk-In Wednesdays, right? We truly know we're helping the community. So our goals, our missions align, right? Like our goal is to provide financial education, financial literacy for our community. Everybody is welcome, right? That's why we're partnering with you guys. So just wanted to share a quick story of a member that we had met at one of your Walk-In Wednesdays. This member had some questions on banking, credit scores, how they worked, right? Was not very familiar with the banking system, was kind of scared, right? Finances are very personal. So we take this with a badge of honor to be the trusted advisor. So with this member, we invited them in to discuss their goals and how we can help them make real financial progress. So this member came in to our branch. We can reach out via phone or, welcome in branch. We help this member understand how banking works, that they should not be paying fees to have a bank account, help them understand how credit works and how we can help them build it up. And then, one of the major goals of this member was to purchase a home in the next couple of years, right? Like something they hadn't really thought they could do. So we put a plan in place. The member is currently building credit. The member is currently saving for emergencies. And this is all something they've been dreaming of doing, right? So just having these conversations and having that, being the trusted resource in the community, like that's what we really want to do. And that's what you all are doing. So it's truly inspiring. Now this member has a better understanding of banking, how credit scores work. They have a plan in place. They are going to reach their financial goals, right? And then they're going to be able to make informed decisions for themselves. So just wanted to share that. I think it's really powerful how when we all work together, great things can happen. So
thank you, Kyle, for sharing. Love that story. Any other comments or questions?
I have one. This is Maria from Red Shoes. What do you need from us, Lisa and team? What us being the community?
Well, financial support, Maria.
Okay.
Also we have the winter gear drive going on right now, and that is huge because I know as soon as we put it out, it's going to disappear. Winter gear drive being all ages, all sizes, and winter jackets. I'm looking at you, Maria, like Maria Mason, like gloves, hats, the whole deal.
Snow pants, boots, and gender neutral as much as possible.
Yeah. And then also just to plug, the Performing Arts Center too is doing a beans and rice drive for us right now, which is hugely, hugely helpful. I think a lot of you have been inside our bodega. This again is driven by our community members, what they want. So beans and rice are always well received. So anything we can do to make our program sustainable and through donations like that are really targeted are always helpful.
And how do we make donations of the winter gear or the food?
We always recommend your best chance is just come to a walk-in Wednesday, 11 to 1. Is that right?
Okay.
I got that right. Yeah, 11 to 1. Otherwise, give us a call or send us an email.
Thank you.
You can also drop off the rice and beans at the PAC's ticket office. We are collecting in celebration of Soweto Gospel Choir that will be here in early November. And we've also been able to provide some tickets to MCI for some of the members to attend.
Cool. Thank you for that. And I have to tell you, because of the Beans and Rice Drive, that the Hindu Temple also reached out. So we're starting a collaboration with them too. So we went over there last Friday and they supplied us with quite a few beans and rice. So thank you for that. Any other comments or questions?
I want to just add to give you a idea as holidays come up, speaking of like the rice and beans drive and our winter gear drive, that it is wildly appreciated if you would like to do something nice for the holidays, that you can always host a drive for us. We have a list of donations, like a donation wish list on the website, or you can reach out to me directly. Any of the items that would support the bodega program, we would gladly accept that if you wanted to host a drive at your location.
Did you make the plug for volunteerism too?
We also love volunteers, and because that bodega program has become its own entity, we are always looking for supports. So of course, Lisa mentioned in the beginning, like Wednesday walk-in hours. We always need support, and it is a great way for you to connect to community members. It's an amazing experience, and it is an experience of itself. So walk-in hours are always available. Tuesdays, Monday, Tuesday, Thursday, 10 to 1. If you want to come do some laundry, if you want to stock some shelves, if you want to sweep some floors, we would love to have you.
Comments or questions regarding our body of work, programs of work, anything like that? Thank you, Gina, for posting. There's quite a few things regarding the Rice and Beans Drive, and it looks like the Winter Gear Drive and the Dia de los Muertos in Chilton coming up as well. So with that, we will conclude. I think we started with gratitude. We wanted to end with gratitude. We are grateful for all of you being on this call and sharing in this journey with us. And please let us know if there's anything we can do from our end to support your organization or people in need. We're just super grateful and have a lot of gratitude to be in such an amazing community where we can serve one another. So we appreciate you. We will hang out online a little bit if anyone wanted to hang out and talk more. Otherwise, you have 2 minutes until 1 o'clock. So free to go. Thank you so much, everyone.
I have all of you here. So, Lisa.
Yes, ma'am.
So, because all of you are here, so I want to talk to you really quick. In regards to they harvested some stuff from the farmers yesterday, and they have like boxes of peppers. So they have the spicy peppers. He's got a bag for you, Lisa. If anybody else wants spicy peppers, we have that. And then we also have, like, I don't know, he said they were like the long peppers that are not spicy, but you can cook with them and stuff. So he's got 2 boxes.